on its way. We are agents representing quality control. I am Agent Schoenborn, and this is my colleague, Agent Vargas. We received a distress signal in the sky from a hospital summoning us to evaluate the quality control program in their radiology department.
A quality control program is vital to imaging departments, as it will promote quality assurance by decreasing the likelihood of repeats, unsatisfactory images, unnecessary absorbed patient dose, and incorrect X-ray positioning.
It is for the department's efficiency, effectiveness, and safety.
Daily, monthly, and annual duties are carried out to continually test equipment and monitor exposures. This will ensure quality acquiring and processing of the digital images.
Quality control is a coordinated and cooperative effort involving radiologic technologists, medical physicists, management, and possibly a member on staff who solely maintains and enforces the quality control program. We are going to demonstrate the roles and how their duties are carried out later in the video. In computed radiography and film, the leading cause of repeats were incorrect technical factors being used and an image being underexposed or underexposed. Repeats done using computed radiography and film took much more time and effort since the cassettes or films needed to be further processed, so techs had a good habit of only repeating when absolutely necessary. The repeat rates in computed radiography and film range from 10 to 15%.
Although DR systems were a huge advancement and upgrade from CR and film, digital equipment did not make repeat rates decrease to zero. Studies have shown that some departments using digital had repeats decrease to 5%, but some stayed at the same rate as what they were when they were using film and computed radiography. Some departments even demonstrated repeat rates increasing to 17%.
The leading cause of digital radiography repeats are positioning errors. When it comes to digital radiography, the image receptor does not need to be further processed. It is so easy and quick to repeat an image. All the technologist has to do is click on the view again and shoot. This quick and easy process of setting up for a repeat has made techs form bad habits.
Some techs adapt a habit of not precisely positioning for the initial exposure because they know they can easily repeat and fix it if they need to.
Some may also repeat images that were already acceptable in diagnostic to begin with. Sometimes a patient's anatomy may be overexposed, but to the radiographer's eye it looks acceptable. This is why there are quality control features set in place to most digital radiography equipment, such as Exposure Index. Exposure Index provides a guide to radiographers regarding appropriate technique usage to create an optimal image. There is a table of appropriate EI ranges determined for each system, usually hung and accessible to staff in the exam room. It is the technologist's responsibility to look at the EI number and see if it is within the EI range before sending over any image to PACS. Over and under exposures are also indicated by the deviation index. A perfect exposure will be 0, and the acceptable range is between -3 to 3. Looks like the tech is ready to expose. Let's see how she did.
Okay, this looks good. I'm gonna send it over to PACS.
Look at your EI number. The target EI for this case is 429, and the EI you got is 3,505. Based off that and the DI number that's 9.1, you should know this is overexposed and should not be sent to PACS.
A few moments later.
Following the EI and DI ranges that my quality control program enforces, I repeated and obtained an acceptable and diagnostic image. I can now send this image to PACS. Most problems that occur in DR and CR occur due to the equipment itself. Therefore, it can affect the quality of every image and radiation exposure of every patient until the problem is identified and fixed. This is why the quality control program mandates equipment testing daily, monthly, quarterly, and annually. The quality control program must have these tests documented and include step-by-step instructions. On the right is Atlanticare's quality control program list of tests with how often they must be performed. The policy states that all tests should be performed at their specified frequencies. The tests can be done more frequently than specified, but never less frequently. For example, it is perfectly acceptable for repeat analysis to be done more frequently than quarterly, as it's stated on the policy. I am sure we have all had to repeat at least once since starting clinical, so you must recall a pop-up screen that looks like this, asking why the image is being deleted and why it was repeated. It will give the tech options like motion, mispositioning, artifact, and some even have an other option for the tech to write out the specific reason why it was repeated. This data is stored and is used for repeat analysis. The repeat analysis helps identify what the leading causes of repeats are for a specific tech or piece of equipment, such as a portable. The data also calculates the repeat rate on the specific equipment piece, which can be combined with others to calculate the repeat rate of the whole X-ray department. Clearly, repeat analysis is a valuable tool for quality control. There are two specific ways that our book mentions can help departments reduce repeats. One being an independent quality control tech who monitors each image taken by the system. The other way is by incorporating a quality control exposure counting system, in which the number of images taken and the amount of times a patient is exposed is compared to the amount of images in the order. For example, if a tech gets an order for a 3-view ankle, but the tech had to repeat their oblique and lateral, resulting in 5 exposures and taken images instead of 3. We went over repeat analysis, but Agent Schonborn and I wanted to go over the light field alignment test too. As we mentioned earlier, each test must have documented step-by-step instructions, which this is a great example of, but it's just a lot of information. I think we're going to need to call in help.
A few moments later.
I heard you girls need some help.
Thank God our senior Agent Thompson was able to come in and show us how she does the light field alignment test. Basically, this test is done to figure out how well the light field on the tube matches to the X-ray field itself. Ideally, we want the light field and X-ray field to be coincident to one another, because we are using this light field to position our patients. If our light field is perfectly collimated to the anatomy, but we take the exposure and one of the edges of the anatomy got clipped, then the light field and X-ray field do not coincide with each other. This specific quality control test involves placing coins at the edges of the light field, with the coins' edges fitted perfectly to the edges of the light field. After the exposure, if there is a misalignment seen on the image, it is measured and plugged in to a specific equation to calculate the total misalignment in inches. Misalignment cannot exceed 2% of the SID used. For example, for our test, we used the SID of 40. So misalignment must be under a total of 0.8 inches. If total misalignment were to exceed 0.8 inches, then service would need to be called to fix the equipment. Lastly, annual tests include a quality control survey or checkup done by the medical physicist to make sure the program is running in an organized manner. This includes selecting a qualified individual to perform the quality control tests, which could be a technologist. Annual tests also include an overall quality control program review and a lead shield integrity test, which is done in the floral room to check for cracks in the lead aprons. If cracks are found in an apron, it is disposed of. Clearly, there's a lot that goes into a quality control program. Hopefully, by the end of this video, you can see why it is so important to imaging departments. It will promote quality assurance by decreasing the likelihood of repeats and, again, unnecessary absorbed patient dose.